Hi everyone, I'm Donatella Massai, Senior Technical Lead of the READY Initiative, and we are joined today by Linda Mobula. She is a physician and a research associate at the Johns Hopkins Center for Humanitarian Health. She recently served as health advisor for the 10th Ebola outbreak in Democratic Republic of Congo. And today she'll share her experience in community health programming and adaptation. Welcome, Linda.
Thank you for having me.
So Linda, in your experience in Democratic Republic of Congo and the Ebola outbreak, what have been the adaptation that you and your colleague had to do in the field, especially related to community health programming and the inclusion and the relationship with the community? And at the end, how do you think that this experience can help us as well in adapting programming for the COVID response?
Thank you for that, Donatella. I think it's really important to note that the 10th Ebola outbreak in DRC occurred in a humanitarian setting. And this was the first time that this has happened. Typically, previous Ebola outbreaks had occurred in areas that were either rural or urban, but for the first time it occurred in a conflict setting where there had been a lot of humanitarian programming. And so this is extremely important to note because it does have implications on how to do programming for an outbreak response. I think one of the key lessons that we learned that potentially wasn't done in the beginning was to utilize existing community structures. It's really important to utilize existing community structures for risk communication, community engagement, but also for infection prevention control, safe and dignified burial, but also for interventions such as surveillance. And I think the reason why this is important is because this generates trust. In order to have an effective outbreak response, you have to have the trust of the community. So in DRC, some of the pre-existing structures included things such as community health workers, which were called relais communautaires or RECOs. In addition to that, we had another structure called CACs, which stands for these local community committees that were composed of various members of the community. And so these CACs were actually transformed into structures utilized for the response that did community engagement that also assisted with interventions such as contact tracing. One of the important messages that we got from the community was when you do interventions for an outbreak response, we want people from the community actually conducting those interventions. Key leaders, traditional leaders, told us, you need to come through us first if you want to do contact tracing because the community trusts us. And by going through us, you gain the trust of the community and you're better able to adapt your response and facilitate your response. So I think the existence of these community structures is important to leverage, but also engaging with these leaders. And it's not just with risk communication, community engagement, as I mentioned. When you work with interventions such as infection prevention control, safe and dignified burials, surveillance in the community, including contact tracing, active case finding, it's really important that these interventions are embedded within these community structures. And I can say that when you go from an Ebola response to a COVID-19 response, there are additional adaptations that need to be made. I think DRC did this well. The outbreak, the COVID-19 outbreak in DRC started in March, and this was during the final couple of months of the Ebola response. So DRC was able to utilize some of the infrastructure for Ebola and adapt it to the COVID-19 response. Transmission for COVID-19 is very different from transmission for Ebola. It's spread through respiratory droplets and not less likely to be spread by direct contact, like Ebola. And therefore, when you're working with community health workers, they need to be provided with materials to protect themselves, such as masks, potentially gloves, or whatever is needed for them to protect themselves so that they're not spreading COVID-19 within the communities in which they're working. So not just providing supplies, but also adapting the messages around transmission, for example, is going to be also very, very important. So going back to the issue of trust, I think when you have programming that is centered around the community, I think it's also important to obtain feedback from the community to see how effective the response is. This is something, again, that was done in DRC quite well. It was actually extremely important and critical to the response. There were mistakes, errors that were made in the beginning when the interventions were not done and centered in the community. And by obtaining community feedback, the responders were able to adjust the response to ensure that the community was engaged, but also that they were okay with how the response was going. I do think that the same needs to be done with COVID-19. UNICEF, through the CAS model, which is the community feedback model, also implemented this. They have been able to obtain community feedback in places like Kinshasa and other provinces in DRC. And I think this is extremely critical. I think it's really important to obtain community feedback so that we're making sure that these public health interventions are well understood, well received, and that the community remains at the center of these interventions for an effective response.
Linda, thank you so much for sharing this experience. Working with the NGO in the field and all of us being confronted with the COVID at the moment, which would be maybe three takeaway from your experience on the Ebola that can really be key in responding to the COVID pandemic?
I think when you're thinking about NGOs, I think it's important that NGOs look at existing programming that they already have. What are the existing WASH programs? What are the existing IPC programs? What are the existing community engagement programs? How can they be leveraged and slightly adapted, transformed into effective COVID programming? I think that's lesson number one. Utilizing existing NGO programming and adapting it to COVID-19 response. The second lesson, I think, is, again, community feedback. Are these NGOs going through the community to obtain feedback from the community on how effective their response is? I think we know how effective a response is when the community responds in a positive manner to that response. I think the second lesson would be to obtain community feedback. Number three, I think it's really important for these NGOs to work directly with local community leaders. Traditional leaders tend to be excluded, religious leaders tend to be excluded, community leaders tend to be excluded, I think, from programming sometimes. They are the gateway to the community. And if you want effective programming, it's really important for NGOs to work with these community traditional religious leaders to ensure that there is also a level of trust that is obtained by working with these community leaders.
Thank you so much, Linda, again. And thank you for sharing with us your experience. And we really hope to see you soon, and all the best from us.
Thank you.